Hello, my name is Ruth Cates, and this is a social validity and diversity presentation with an emphasis on autism spectrum disorder. The purpose of this presentation is to shed light on certain aspects of social validity and cultural considerations when providing services to individuals and families with autism spectrum disorder. Within this presentation, specifically, we will be addressing intersectionality of an autism diagnosis. It's important to note that intersectionality includes multiple aspects of an identity, which in this presentation we're going to address gender, race, and socioeconomic background on top of an autism diagnosis. By addressing all these components and more components, this helps to create the sense of cultural competence and ensure that as a practitioner, you are providing the best care and providing a cultural match for your family. We're also going to be addressing family mental health. By addressing mental health, this helps to understand what is feasible for some families in terms of intervention implementation and how to support families throughout the intervention process, as well as assessing your own personal bias throughout the treatment process so that you can take into consideration more cultural aspects and be competent within those areas. When providing services to a variety of different family units and individuals from a variety of different cultures, it's extremely important to have cultural competence. Cultural competence can be defined as having an understanding of different aspects of a culture and how these cultural aspects affect both clients and caregivers. This process of cultural competence is an ongoing and lifetime process. This is never going to end. You always have more to learn. And once you think you've learned everything, there's another section that you can continue to look at. When thinking about autism and intervention and even diagnosis, cultural beliefs are very important in this process and will influence the way that intervention is accepted as well as the diagnosis is accepted. So, going into these processes with an understanding of specific cultures is key in knowing how to interact with families and the clients throughout these processes. Make sure that when you're doing an intake with a client, it is very important to have a section where you identify those relevant cultural variables. And following gaining that knowledge, you're doing further research to find ways to incorporate these components into the intervention process and how to make sure that you are honoring families' wishes throughout the process. By creating a sense of cultural safety and ensuring that you are practicing cultural competence, this goes hand in hand with providing socially valid services, which is key in an ABA process. Every person has their own unique combination of attributes leading to your own intersectionality. Within the autism diagnosis, this is going to be one component of your intersectionality or your identity, along with other aspects such as race, gender, nationality, sexuality, and many other aspects within this. Every individual it's going to look different for, and it's really important that when looking at intersectionality, this is a way of viewing the person as a whole and ensuring that every aspect of their identity is taken into consideration when developing and implementing goals. If you're only assessing parts of a person or parts of their identity, then you are not providing ethical services and you may not be providing effective intervention. So if you're only focused on that autism piece of their intersectionality, but you're not looking at cultural beliefs or nationalities or family structure, then you may be implementing interventions that cannot be properly maintained or are ineffective for that client. So make sure that as you're going through the assessment process and throughout treatment, that you're constantly taking these intersectionality aspects and components into consideration for each individuals and their families. One specific aspect of intersectionality that is especially relevant through the lens of autism and autism diagnosis is gender. Research has found that one female per every four males is diagnosed, and they're diagnosed an average from a year to 2 years later than males. Females diagnosed with autism often have a different symptomology and they present in different ways. Some of those include fewer outward repetitive behaviors, such as hand flapping and spinning, and more internal repetitive statements. They also have more restricted interests, but they tend to be more socially acceptable, and their word knowledge, vocabulary, and ability to mask is often higher than male counterparts. The diagnostic criteria for autism is also based on the male phenotype. So, since autism is often presenting differently in males and females, using the traditional autism diagnostic process may not be truly reflective of the female phenotype or female symptomology. So, by starting to look at, assess, and use different diagnostic criteria or different indicators for females rather than males, you may be able to kind of bridge that gap for that diagnostic barrier in terms of getting diagnosed at all or the age in which you are diagnosed as a female with autism. Another relevant aspect of intersectionality is race. It's found that children in racial or ethnic minorities are less likely to be diagnosed in a timely manner than white children, despite research reflecting that they exhibit more signs at an earlier age. Specifically, Black children are more likely to be diagnosed with a conduct disorder or adjustment disorder before receiving an autism diagnosis. Other relevant cultural minorities are Asian Americans and Hispanic American cultures. These cultures all have their own specific aspects to their identity and ways that they interact with the world. So, for example, African American families are driven by Afrocentric beliefs, and there's an emphasis on safety, which often leads to interventionists interpreting their behavior or their parenting as harsh and controlling, when in reality, they're focused on safety. Asian American families, they value education, they value the perception of others and communication styles within their culture. As a result of this, when they have an individual in their family diagnosed with autism, this may lead to a lot of feelings of shame and isolation within their culture. So, this is something that you will most likely have to assist this family in navigating and helping them feel understood and empowered in these moments. Hispanic families have been found to have a higher risk of mental health concerns compared to other parents with children with autism spectrum disorders. And when addressing Hispanic families, it is important, and the literature reflects that you should be mindful of women in the caretaker roles, as well as understanding the immigration status of your client and their family. Throughout the intervention and diagnostic process, there are many different steps and actions that need to be taken that often involve either paying out of pocket or dealing with insurance, specifically seeking out private services for both diagnostic and for intervention services. These are areas in which you may have to have insurance to complete these steps or engage in these steps, or if you do not have insurance, you may not be able to afford these steps. On top of the insurance of all of these aspects, it is found that there are many families who face hardships and challenges that surround having a job or gaining employment due to having to care for their children with autism. The schedule and need for adaptation within those schedules are often hard for many jobs to understand. If parents have to leave to go take care of their child, or if something comes up at school and they have to pick them up, it may be difficult for them to hold a job in that sense. Without income, it may be difficult to pay for intervention services or any care needed for their child. So, if a family has a lower socioeconomic bracket, they have less access to all these services. And in turn, by having to provide care themselves around the clock, this can lead to burnout and many other mental health concerns. As mentioned in the previous slide, one aspect that may contribute to family mental health is the care levels required for children with autism. Every person is different. Every person has different support needs, which we'll also get to later in this presentation. But in terms of mental health, by providing around-the-clock care, families may experience depression at higher rates. It has been found that parents with autism have higher rates of depression in comparison to parents of children with other disabilities. This stress may in turn change the parenting styles for many individuals, leading to more harsh and inconsistent forms of parenting. Sometimes this can turn into a vicious cycle of children are engaging in behaviors. This is leading to stress for the families. Then that leads to harsh and inconsistent parenting, which then in turn increases the behaviors in the future. So this can be a very difficult process for many families. And this is something that you may need to work very closely with your families to help. One thing that is recommended is providing as many options and supports as possible. This can look like furthering education, ensuring that there are positive mental health supports put in place, and empowering parents. Some other ways to help support mental health are keeping parents in mind when creating implementation procedures. So, ensuring that it is feasible for parents to implement different procedures and interventions so that you're not adding more to their plate and causing more struggles with mental health. Um, as mentioned before, providing lots of information on support groups. Make sure that you and your other providers are providing a safe space for this family and that you're celebrating the small wins and small victories. These small things can really help build a family's empowerment. And without an empowered family, the progress in the intervention may be challenging. When engaging with families of a variety of cultural backgrounds and other intersectionality aspects, it's important to understand bias and the different types of bias that you may hold within yourself. Everybody has bias, specifically implicit bias. This is just human nature. This is pattern recognition, and this is taking in information that has been fed to you. But what is important is that you understand what this bias may look like and then work to unlearn some of these biased thoughts and work to reframe your thought processes. There are many different types of bias within the scope of providing care to autistic individuals. It's very important to understand and address different forms of bias, some of which include conformity bias, which is when you're in a group and you decide that you're going to agree with the statements of the group in order to fit in. This can be a barrier when in, let's say, an IEP meeting or in group settings where there are a lot of people who are giving insight and giving their opinions into a client, and this may be in a derogatory way. This may not be strengths-based approach. They may be expressing an opinion that is not entirely productive for the client. And it's important that even though the majority of the individuals in that setting may be presenting with those thoughts and opinions, that you are not exhibiting conformity bias and agreeing with them just for the sake of fitting into that group and not causing waves. Um, Another important aspect of bias that is key during addressing and providing interventions for individuals with autism is the halo effect, which is when you take one specific attribute of a person and you take that as the one thing that you are addressing things based off of. In this case, autism would be that aspect of them. So only looking at the person in the lens of autism or without taking into consideration other intersectionality components, this may present as harmful as you're not looking at this person as a whole. And this can even play into that concept of a savior complex, which is I see this person as lesser and I'm not focusing on the strengths or the whole person. So therefore, that reflects kind of that savior complex idea. The last type of bias that's important when working with individuals with autism is the contrast bias, and this is when judgments are made based on comparisons to others. This can be especially harmful when looking at assessments or producing goals. You want to be careful not to directly compare your autistic clients to other people or use a lot of norm-based types of interventions. The goal is never to force neurotypicalness onto a client, but is to help build on their skills and their strengths within the settings and help them navigate through this. So, without proper knowledge of bias and understanding and the different ways that this can present, it's going to be extremely hard for you to work with families in a way that is culturally responsive and helps encourage social validity. An important aspect of understanding bias and avoiding bias during your interventions and working as a practitioner is to assess your own biases. And a couple ways you can do that is explore implicit associations, and attached is a link to the implicit test that Harvard has put together. This is a way for you to test your own implicit biases and start to kind of assess and unpack what those look like for you. You also can reflect on your own personal experiences. So everyone's lived experience affects the way that they interact with the world and affects the opinions that they have. So thinking about what you've experienced and how that may differ from others is important when looking at and assessing biases. Within that, recognizing thought patterns and acknowledging thoughts as they emerge in your mind is the first step in beginning to challenge and reframe that thought process. So if you find yourself having a thought that you may think associated with bias, then you want to go ahead and begin to recognize that and then jump to the next step is beginning to challenge and reframe those thought processes. So acknowledging that thought in the moment, asking yourself, why am I thinking this? What is those lived experiences that have built this? Did this connect to any of the implicit biases that I've taken in a test? And beginning to kind of reframe those so that the next time you may have those thought processes, it will come up a little differently rather than through a biased thought. An aspect of bias that presents through society is the perception of autism, and how stigma can be related to that. There are many, many families who have a member that has autism that will experience a level of stigma that other families that are neurotypical will not. Um, One specific area of concern for many families is going on outings due to behaviors or negative social interactions that they may receive. A study showed that 85% of caregivers to profoundly autistic children have experienced stigma in their community. Stigma is the disapproval of others based on differing social skills, and autistic individuals often fall into this category as one of the main components of autism is social deficits or struggles in social communication. Um, Many individuals in the public eye or just in public in general do not have a complete understanding of autism and all the different levels within the spectrum of autism. A lot of media portrays autism as having a superpower or higher cognitive abilities or like savant level talents within that. So being sure that as a practitioner and as an advocate, you are providing positive and accurate representation of autism. And that in itself, by providing awareness, helps work to fight stigma and fight those biases that people may hold within themselves about autism. Um, and you can work with families to help empower them to be more open about their experiences just by providing insight into these experiences and personal lives and ways people live with autism and different family structures. This is a way to provide information to the general public that may help reduce stigma and reduce those biases just by providing awareness and representation to the general public. In connection to stigma and bias with the perception of autism is differing levels of support needs. So when an individual receives an autism diagnosis, they are to also receive a level. So level 1 is minimal support, level 2 is substantial support, and level 3 is extensive support. So extensive support often comes with more challenging behaviors and a decrease in self-help skills. But within both lower support needs and higher support needs, there are different barriers and biases that come into place with this. For lower support needs individuals, often specifically children in this example, will be able to integrate into a regular education classroom, but they may not qualify for in-school services. So although they're able to integrate with their peers effectively and complete schoolwork and things of that nature, they may still experience social barriers and difficulties that lead to bullying, and in turn, this could lead to more negative mental health outcomes for them in the future. A lot of times, people with lower support needs often have their autistic traits or aspects of their personality downplayed. People will say, quote unquote, you don't look autistic, or make those comments to parents, or downplay the support needs, even though they are low. This does not mean it's no support needs. So, although someone may have low support needs and they may require some support, they are not a neurotypical individual and they still require supports. In terms of level 3 or high support needs barriers, many high support needs individuals will need around the care clock, or some will even attend a residential facility for care. This requires payments and a lot of family interaction within these situations. So if families do not have the means to afford around the clock care or the means to find a residential facility, they may in turn be the ones providing this around the clock care. And in connection to our family mental health, this could lead to burnout, depression, anxiety, and other mental health concerns. If an individual with high support needs has substantial behaviors that may put others or themselves at risk, it is often hard to find a residential facility that will accept them or anywhere of providing care that will accept them. So at times, parents are having a hard time at home handling these behaviors and in providing a safe environment for themselves and others in the home, while at the same time while seeking that support and trying to find somewhere where their child can go to receive care, they may not have access to that due to those behaviors. Getting medical care is also a very real concern for high support needs individuals. Finding doctors or nurses or medical people who are trained to handle high support needs autistic individuals, or the communication that comes with expressing sickness or pain from those who may not be very verbal, or the act of leaving the home and going into the medical setting can come with a lot of sensory processing concerns and a lot of safety concerns for both the individual and those providing them care. Wrapping up this presentation, it is important to note that all of the components listed today, plus many more, are all relevant in providing socially valid and diversity affirming services. So making sure that you are practicing social validity, understanding the priorities and cultural beliefs of your clients and their caregivers, and being open-minded to collaboration. Without being open-minded and being open to discussion, criticism, and implementation options, you will not be providing the best services for your client. You want to continuously practice cultural competence, so always be learning as you navigate each new family structure. Cultural competence is a lifetime process and you will never know it all, so continue to learn, continue to be open, and continue to ask questions. Assess each client and their family's intersectionality and take into consideration them as a whole. So not pinpointing a single aspect of their identity, but making sure to take into consideration all aspects when planning goals and engaging in the intervention implementation process. You want to understand that there's bias exhibited towards individuals diagnosed with autism and what that may look like, whether it's barriers in support needs or assessing your own personal biases within this lens. This could also look like engaging in advocacy work, making sure that you're drawing attention and awareness to the autistic community and helping educate the general public. All of these aspects put together, plus many more, are all relevant to ensure that the care you're providing is culturally valid, socially valid, and is diversity affirming.